This is a special report from News 3 WSIL.
Hello again, I'm Julie Williams. Tonight we start a new segment called COVID Conversations. We'll look at COVID-19's impacts here in our region and what it means for you, our viewers. We start tonight with Southern 7 Health Department, and I'll turn it over to my co-anchor Mark Kiesling for that.
Thank you, Julie. We're joined tonight by Nathan Ryder, the Contact Tracing Outreach Coordinator for the Southern 7 Health Department. Nathan, thank you so much for being here with us tonight. First of all, what is a contact tracer? What exactly do you do?
Yeah, so a contact tracer is somebody who works for the health department. We have them spread all across the state through IDPH, but basically their job is when somebody is testing positive for COVID and their test results come into a health department, contact tracer that works for that health department is going to reach out to that person who's positive, check in with them, see how they're feeling, what their symptoms are like, and get those close contacts that they may have been in contact with. So then the contact tracer can reach out to those folks and warn them, hey, you've been exposed to somebody who had COVID-19 and you need to take some precautions to prevent the spread.
Southern 7 works with Southern 7 counties of Illinois, hence the name. And what are you seeing when it comes to COVID-19 infections and vaccination rates in your area?
Yeah, so beginning summer, things were looking really good. Things had calmed down, numbers were down. We actually had a day where we had no new cases, and that was a really great thing for us to see across the Southern 7. Unfortunately, as we've progressed through the summer, those case counts have started going back the other direction. So we've seen case counts on the rise. We're seeing more and more infections on a daily basis, and we're sort of in a position where we were before we saw that huge run up during the height of the pandemic this last year. So unfortunately, we're entering a phase that we didn't want to re-enter again, and that's just seeing those increasing case counts on a daily basis.
And you're reporting, was it 72?
That's
new cases today?
Yep, 72 new cases today, and that goes back to Saturday. So Saturday, Sunday, and today, 72 new cases.
All right. And is there much of a difference from county to county when it comes to COVID-19 infections and vaccination rates?
Yeah, you can look at our counties across the Southern 7 and you can see that our counties that are more populated, that have higher population centers, they're going to have higher case counts. They're going to have more COVID-19 cases. They're also going to have different vaccination rates as well. So if you look at somebody like Pope or Hardin County, their numbers are going to be lower, their vaccination rates are going to be lower. Compare that to like a Massac County or Union County, those numbers are usually much different. So we have some very different population centers across the Southern 7. We cover 2,200 square miles, so there's a lot of difference across that area that we work with.
And one of those counties you cover is Alexander County, and Alexander County is the lowest in Illinois when it comes to vaccination rates. What are some factors playing into that in Alexander County?
Yeah, Alexander County has been a tough one throughout the pandemic just because we have not been able to see really good numbers in terms of the vaccination effort down in Alexander County. That's not for trying. We've had several mass vaccination clinics and opportunities. The National Guard actually came in and helped us out in Alexander County as well. But we know a lot of folks in Alexander County are close enough to Kentucky and Missouri that they go and obtain a lot of their health care in those two states. So we think that there's a lot of people who are not reflected in those vaccination numbers who've actually been vaccinated in Missouri and Kentucky. And right now the states just don't have a good way to share that information, that data back and forth. So it's really hard for us at Southern 7 to peg down just how many of those people were vaccinated out of state.
Right, I can see that from that area, and having visited that area, you're right, how many people in that area, they go to school out of state, they shop out of state, and they possibly get their health care out of state as well.
Yeah, Cape Girardeau is an easy jaunt, across the river. And we know that in Cape Girardeau, we had about 1,400 Illinoisans who were vaccinated over there. We don't know which county they were from, but we can presume most of those were probably from Alexander County.
Okay. And you also cover a large geographic area. You just alluded to that. How does the rural nature of your coverage area impact you getting people vaccinated?
Yeah, you look at the Southern 7, we have 66,000 people that live across the Southern 7. We have 4 public health nurses that work full-time, spread between 7 different county clinics. So we're really trying to cover as much area as we can, cover as many population centers as we can. And that gets challenging. The pandemic was a big challenge for us, and so we were very grateful for the help that when our men and women with the National Guard were able to come down and help us out and deploy into some of the more remote areas of our 7 counties and help increase our staff load so we could get through that vaccination effort a whole lot quicker. That was a big benefit for us. So
Now the CDC last week came out with, they approved the COVID booster shot for those who have compromised immune systems. Is that going to be available soon for people in our area who need that booster?
It is. We're currently waiting on some guidance from the Illinois Department of Public Health, just how that rollout process is going to happen. But based on the information that we have from the CDC and the FDA right now, we're looking at folks who are severely to moderately immunocompromised. So we're talking about cancer patients, organ transplant patients, folks who are on immunosuppressant drugs. So we've got some qualifiers that are out there. If there's individuals in the Southern 7 who think that they need to get that booster shot because they meet one of those markers, we're certainly asking them to give us a call, and we were going to take down their information, and just as soon as that rollout plan is ready to go, we'll be able to reach out and contact them and get them scheduled for that third shot.
There are still many people in our area who are steadfast against getting the COVID-19 vaccine. What is your message to them?
Well, we want to let people know that the COVID vaccines are safe. They've proven safe and effective across the Southern 7. They've proven safe and effective in the state, safe and effective nationwide. We believe in the vaccine. Most of us in the health department have been vaccinated. I got vaccinated myself in the early stages of the vaccination effort. And I'm glad that I did get vaccinated. I think it's really important. We have a really good tool right now that can help us combat this situation and get these numbers down. And so we're beginning to see more and more people, now that numbers are on the rise, beginning to make that decision that, hey, I probably better get vaccinated now. You know, it's been out long enough. People have not had severe side effects from that vaccination effort. So maybe I need to step up and do my part too.
With the Delta variant springing up, are you seeing an increase in requests for COVID-19 testing in your area right now?
We're seeing an increase in testing, requests for testing. We're seeing an increase in requests for vaccinations. So yes, things have gotten much busier at the health department the last week or so. Phone lines are ringing off the hook. Our receptionists are working, nonstop overtime trying to answer all those phone calls right now. So yes, right now testing is not as widespread as it was during the height of the pandemic. So we have limited testing resources across the area right now. But SIH and Marion and Carbondale both have their testing operations up and going. And so that's where we refer most folks at this point.
Now, when you get tested for COVID-19 right now, does it show if you have the Delta variant?
So the state is actually pulling those tests. If you go and have a lab test done, they will actually pull those tests and figure out which markers or which variants you have in those tests. We don't necessarily see that at the health department, so we're kind of in the dark as to if Delta is, if your case is a Delta case,
okay.
Let's say that. But at this point, we pretty much presume that most cases in the region are the Delta variant, just because it's so widespread and so easily transmittable between people at this point.
All right. Nathan, thank you for joining us. We'll check back in with you in just a moment, but right now we want to check in with Julie and get some updates on some numbers across our region.
Yeah, thank you, Mark. We'll take a look at those new cases in the states that we cover. There are more than 2,400 new cases in Illinois today, and Illinois health officials report 4 new deaths with that. Now, in Missouri, health officials say on average there are 2,700 new cases every day, and in Kentucky, they report 2,100 new cases in just the last 24 hours. Health officials also report 8 new deaths with that. And tonight we've learned Kentucky's 7-day positivity rate is at 12.4%. Now the surge of COVID cases is expected to continue, and there is concern tonight that it'll only get worse as kids head back to school. Health officials are worried about the strain it'll put on hospitals. Stacey Cohen has more.
Back to school policies become the latest pandemic battleground as case numbers climb across the country. One official warns the U.S. could soon hit 200,000 new cases per day as the Delta variant spreads, with terrifying risk for the unvaccinated.
All we can say is that this is going very steeply upward with no signs of having peaked out.
Children and educators returning to in-person learning are getting conflicting messages on masking in some states. The governors of Florida and Texas issued executive orders banning mask mandates in school, but some districts, including Dallas, Texas, are defying the order by requiring masks in school.
We're going to be nice about it, and we're going to be benevolent to a point. We're going to give them a little bit of time to comply, but we're not going to let them mix with the rest of the students.
The U.S. Department of Education sent stern letters to Governors Ron DeSantis of Florida and Greg Abbott of Texas, vowing to support educators who require masks. More children are now being hospitalized with the virus, with those 17 and under hospitalized last week in numbers 21% higher than the week before, according to CDC data. Oregon is deploying the National Guard to help stressed hospital systems. Officials insist vaccination is the most effective way to slow the spread, but just under 51% of Americans are fully vaccinated.
Heartbreaking situation where 90 million people are still unvaccinated who are sitting ducks for this virus, and that's the mess we're in.
I'm Stacey Cohan reporting.
We're joined again by Nathan Ryder of the Southern 7 Health Department, and that story mentioned 21% increase in hospitalizations involving children 17 and under. What are you seeing in your area when it comes to children and COVID-19?
Unfortunately, our numbers are pretty much the same. If you looked at the same time period last year, our childhood cases accounted for about 10% of our total COVID cases. When we looked at the data of the last 2 weeks compared to the 2 weeks, in the previous year, we're looking at that now being about 33% of our cases are school-age kids. That's a concerning trend for us. That's something we don't want to be seeing. And, unfortunately, most of our school-age kids aren't able to get a vaccine, so they have very limited opportunities to try to prevent the spread. That's why we're really relying on masks and sanitization efforts in schools to be able to keep them in school and to keep them from getting COVID.
From what you've seen through research and your personal experience, how effective are masks in schools at preventing the spread of COVID-19?
Well, I think our contact tracers will tell you that of all the kids that they dealt with over the previous school year that became infected with COVID-19, there are close contacts who are sitting near them in class, who are properly wearing their mask. Very few of those kids ended up developing or contracting COVID. So we know that the spread between student to student was very, very low, wearing masks and having those proper sanitization procedures.
What are some ways, besides masks, that parents can put safeguards in place to protect their children from COVID-19?
Well, definitely, telling your kids to maybe keep their distance from each other, sort of watch your space, have your protective bubble around you, but to also, have little things like maybe a keychain hand sanitizer. So you've always got that so you can wash your hands if you don't get that opportunity to. There's lots of little tips and techniques that we tell our kids, to be safe and to just kind of sort of give each other some space and don't be up in each other's space and don't play with your mask.
18 months ago, when all this COVID started, did you ever imagine that you would be in for this long of a battle against this virus?
Yeah, I think no. The answer to that question easily is no. I think we were all hoping that it was going to be over and done with, within a year. When you're dealing with a pandemic type situation, I think that there's various different ways it can go, and right now we're unfortunately dealing with it going a direction that we don't want it to be. So we just all need to stick together and band together to try to get this thing knocked out. So hopefully we can get COVID back down to some manageable levels and not be dealing with it for even longer than we have to. It's
a very unpredictable virus to get a grasp of, isn't it?
It is, yeah, and especially when you're dealing with a virus that's going to mutate and change over time. That's difficult, yeah.
All right, Nathan, thank you so much for joining us tonight. And we will have this interview and much more COVID-19 coverage on our website, WSILTV.com.